Hey, everybody. Welcome, welcome, welcome. We are live here on Health, Wealth, and Relationships
Good
with
morning. Good morning. Welcome back to Health and Wealth Relationships with Tisa.
and Grants. There we go.
All
Yes.
righty. So we are well into May, and May is also Women's Health Month. And and no shade to the guys. We also need a men's health month. I don't know
Yes,
if
we
there
do.
is one, but today we're going to talk about Women's Health Month because it's important. There's actually some statistics around women's health. Uh, we deal with a lot of stuff. And I think because we're caregivers, we're mothers, we're sisters, we're usually the head of household, that all of these disparities and all of these health problems come up. So I'm just encouraging women right off the bat to start taking care of yourself, be aware of the things that affect your health, and let's just do better at staying healthy about it. So let's
I
get
am
into
here to
women's
listen.
health.
I'm
What
really
do you
here to
have any
listen. I
stats you
want
want to
to. I want to
start
know
with,
more about
Grant?
this.
Because I know there's many.
Yeah. Oh, there's a lot. As I said, I'm here to listen. I want to know more about women's health. I raised a daughter. She's 32 now, thank God, and she has her own child. So I have a grandchild. I have actually three grandchildren, and so I want to know more about this because some of these stats just jump out at me. Like just one, like nearly 1 in 8 women will be diagnosed with breast cancer during their lifetime. Can you
Yeah.
imagine?
And that statistic has been out there for a long time. It really hasn't. We want to change that. Again, all these statistics it's been 1 in 8 in a long time. We really need to, and it might be even more than that for African American women because, of course, we suffer more. But the number one killer of women is heart disease. Did you think about that? It's
No,
heart
I
disease.
I
And I
I
don't know
did
why
think
that
about
is.
that.
I'm trying to put heart disease with, and all I can think of is just, heart disease is directly affected when you don't work out, when you don't eat right. And so kind of goes back to the same old thing, eat right and move, right?
You gotta
But
eat
heart
right and
disease
move for
is
sure.
the number one killer of women. And I think some of that is connected to our heart, like our female connection to our little heart, our love language, our how we move in terms of being mothers and sisters. So that might be a connection because we're more emotional, we're more directly connected to our heart and our feelings. I think that has something to do with the heart disease too. It's got to,
Yeah.
right?
Yeah, I was just kind of shocked by that statistic as I think about it. How many times do I hear about, oh, miss somebody or died from a heart attack? And as the more I think about it, I probably heard it more than I want to admit.
Yeah,
That this is really was the leading cause of what happened. And we know, and we always talk about high blood pressure, diabetes, stroke, all these things are just, standing in front of us. But as you have stated, let's talk about prevention. Let's talk about some things that, like, all right, now we know that it's there. What do you tell us more about women's health that we really don't know about?
well, just some more statistics. I think this statistics say that women delay their care more, right?
Yeah, I
And
didn't
I,
know
and
that.
and we always think about men not going to the doctor, men not doing stuff, but really because I think it says because we're the caregivers, right? The
Hmm.
responsibilities, we're taking care of everybody else,
Hmm.
right? We're taking care of everybody else but ourselves, and so we delay our own care. Probably making sure kids are good, parents are good, and I guess the financial responsibility, right? So as women, we don't make as much as men, and so while we're taking care of everybody, our coins ain't right either, right?
Hmm.
And so that's make us delay care. So that was a surprising statistic for me, but it makes sense, right? It makes sense that we
Yeah,
would delay
yeah.
our care because we're the caregivers. We're the caregivers and we're taking care of everybody else. And so, we might forego an appointment or two to make sure the kids get their yearly appointments. We might, especially if we're paying out of pocket or we have these co-pays we can afford. So I guess it makes sense.
It makes a lot of sense, especially when you factor in and what you just said, because when you miss these appointments, you need to take care of yourself. It creates anxiety, it creates depression. And what I've understand is that anxiety and depression disproportionately
Yeah.
affect women more than men.
Yeah. What do you think about? I think that's probably true to form. We're more emotional, right? So
Mhm.
we're more emotional, we're more connected to feelings. And so when you talk about anxiety, that's an emotion. Emotion, it's an overwhelming emotion, right? It's emotion
Right,
that
right.
overwhelms you. And depression also overwhelms you because most people who are overwhelmed with something just don't deal
Mhm.
with it. So their way of dealing with it is not dealing with it, which is depression. You just go into yourself, you don't communicate, you don't talk about the problem. You just kind of hoping that put your head over the sheets and hoping it goes away. That's what depression is. And you're not just don't deal with it. That's what depression is. And so I can see us doing that. I can see ladies doing that. I mean, we get it. I had an overwhelming week, and then things get missed. And so I had a lot of anxiety going on. Let's
Mm.
just say that. I had a lot of anxiety going on, and then things get missed. I missed a meeting, which I had to apologize for today, but it gets overwhelming. So I can see us being more overwhelmed, more anxiety and depression driven than men, because I don't think y'all get as overwhelmed. And maybe if you do, it shows up differently. Maybe yours shows up in stroke and hypertension
Well, I
versus
think
anxiety and depression. What do you think?
I'm thinking, it's almost like some people express themselves outwardly, some people
Mm-hmm.
express themselves inwardly. I think women they're more outwardly expressive with their feelings, emotions, the anxiety, depression. Where men, you might not think that they're having these kind of feelings, but they do. But they
Yeah,
internalize them more, so you don't see them. And it's not as visible until something more kind of or is more visible in a health situation that comes out, or you're
yeah,
drinking more, you're doing something out of balance, but you're internalizing a lot of that anxiety and depression
in a different way,
in
right?
a different way. You
In a
said it.
different way. So, as you probably know, African Americans always are disproportionately out of the clock on everything health wise, right? We are
Yeah,
just leading in all the bad stuff, unfortunately.
unfortunately.
And so when it comes to Black women, the health disparity, so we're talking about women in general, but African American women, we have a lot of disproportionate numbers in terms of our health, right? So we are, more likely to have blood pressure issues, high blood pressure, diabetes, strokes, and
Mm.
maternal mortalities. Now
I
that one,
was
that
surprised
one
with
is
that.
recent. That
Yeah,
one is recent. And so now we have people like Ivy Black Girl who are just trying to lead the way in maternal justice. We had a Kiki event where the young lady from that was on Fresh Prince, oh Lord, I can't even think of her name, Tatiana Ali,
yeah,
was a part of our Kiki event, and she was
yeah.
telling about her maternal experience. And so and so she joined that whole cause. And so it's become a whole call to action about
Right, right.
maternal health and maternal mortality, because babies are dying at birth right now, and we're losing mothers. But more disproportionate babies are dying at birth, and so there's a whole movement out there right now. And so as we talk about the other ones, hypertension, I knew that, and I think for men too, for
Mhm.
African American men, diabetes. That's just all these are actually just Black people things, right? Of course, they're just not Black women, but this is for Black people. Hypertension, diabetes, stroke, but the maternal mortality is a more specific Black woman thing. And white babies aren't dying.
Mm. I don't
Just like
understand why
just
that
like
is
for
such
breast
a
cancer,
statistic.
that statistic
I
is
don't
still
get it.
out there. White people aren't dying. Black women are still dying from breast cancer. 43% more. And it sounds like a damn slogan now
Mm.
because I say it so much, because it's
Yeah.
not going down. That statistic also is not going down, right? We're 1 in 8 statistically for women, but 43% more dying of cancer than any culture.
I
So
want to unpack that just a little bit and walk through that whole the program that you get into or the process you go through when you're pregnant, right? And I don't
mhm.
know if that's a age factor. Obviously, childbearing ages, from teenage all the way up to maybe your 40s or something like that. Is it now? I know when I was in Florida, they did a study around that, and what they were trying to find out is what was causing this.
Yeah,
They have facilities just like they have here with Charles Drew, and they did a study around that. And what they were finding is that women were coming to get to the doctor around being pregnant later in the cycle,
yeah.
right? And waiting, I don't know, maybe they were 3 or 4 months pregnant at the time, and then they finally started getting care, that type of thing. But why are they delaying that? Is it maybe fear? Is it they don't they think they can take some of these things themselves, but that seems
Well,
to be
I
the
think when it
overwhelming
comes
story.
to well, and when we're talking about delay in care, it's different reasons for different issues, right?
Hmm.
So when we talk about before we get into maternity, say with breast cancer, some of the statistics are showing that we're also getting delayed care. We're catching it
Hmm.
stage 4, right? And so for cancer, I think it kind of comes, well, maybe it speaks to the same thing. Not knowing our bodies early, not going to the doctor regularly, so we catch it earlier,
Hmm.
and not just get information about other ways that you can have breast cancer. People think you've got to find a lump, but there's all other different signs that I think people might be missing, um, that are showing up different ways, and they don't even know it's breast cancer. So by the time they do get checked, it's stage 4. So,
Hmm.
there's nipple discharge, there's dimpling in the breast. There's other ways that breast cancer can show up. And if you don't know that and that's going on with you, you might be going in and be like, hey, there's nipple discharge. If you're not pregnant, you shouldn't have nipple discharge. Right. And
Hmm.
so, but you don't know these things as a 20 or 30-year-old, you're like, or 30 or 40-year-old, you're like, blah, blah, blah. So by the time you go in and get some of these things checked out, I think it's ignored too late.
Hmm.
Going in and stage 4, that's breast cancer. Now, when it comes to maternal health, I think, again, baby making age is right, because I'm not, I wouldn't be dying. It wasn't an issue when I was having babies, but I think some of that is, again, the late stages. I don't think the girls know they're pregnant,
Hmm.
right? So it might just, again, not being careful. It might not be birth control. It might not be knowing the signs of being pregnant. If you've never been pregnant before, and your period stopped, that's all you know, but you might not know other signs of being pregnant, or you have never been, one of those regular women that go to the doctor. Maybe some of our young people are not being as health conscious, making sure that they're taking care of themselves, making sure they're using birth controls, or if they're using birth controls, maybe not regularly, so they're still getting pregnant. I'm trying to figure it out. I joined IB Black Girl really as wanting to learn about that. Why are we
Hmm.
dying? How can I help? I'm always like, how can I help with that? I don't know. It wasn't an issue. I have 2 sons in their 30s. It wasn't an issue 30 years ago. We weren't
Hmm.
dying. Our babies weren't dying. It wasn't like, hey, what's going on? It's just become an issue. So again, I think it's going to be education to our young ladies about
Hmm.
your body. Start with your body. I got to tell them about breast cancer. Start with knowing your body. You have to know your body. You have to go into the doctor regularly. We have so many things going on as women. We have to get pap smears. We have to get yearly checkups. You have to know your breasts. We are baby makers. So there's all kind of stuff going on with ovaries and, stuff that y'all don't even have to deal with.
Yeah.
As women, we have to be diligent about your body, knowing about your body. Having, take it back to old school with some of these teenagers, because they've taken like health. Remember health? They've taken health out of some of the schools. I think you have to opt in or sign in for health now, where that was a regular class. But that
True.
was just taught you about men's voice changing, girls getting their period, how your body's going to change. Those are necessary things to know as you grow. And if you take
Right.
that out when they're young, we're going to be even in a worse situation later.
I think one of the things that all those things you just said was true. I also look at the factors around being able to see a doctor,
Mm,
insurance. Are you aware that there are free clinics? So the cost is not a barrier. And then
mm,
some of these free clinics, they get overwhelmed too. Like, all right,
mm.
yes, we can get you an appointment, but it's going to take you a month to 2 months to get in to see
3 months. Yeah, yeah, you're right.
maybe that could be part of it. So by the time they actually are seen by a professional, they're much further along. There's complications, and do we hear about
Sure.
complicated, pregnancies a lot? You're a breech
Mm-hmm.
baby, you're this or that. Things are happening. If you're gainfully employed, it could be a lot easier because usually that comes with insurance. You have
Mm-hmm.
insurance, you have a
Mm-hmm.
provider, you can make an appointment, you can go see somebody. If you're not, you don't have, you're not insured, you're underinsured, or you just don't have any insurance at all, it's a different
Right.
story. It could
Yeah,
be a
yeah.
different story.
You're right. You're right. Even when you have insurance, you can see your doctor, and they're telling you, yo, we gotta. It's June. They talking about September. And you're like, our doctor's really that busy? I don't know. Are they? Are they on
I don't
vacation?
know. I
It's
can't
like,
I
what
can't
is
answer
going?
that. but
I
that
don't know,
delay
but
in getting care,
it's hard to get that care.
yeah, and getting regular care and understanding, or have you regularly gone to a doctor in the first place? If you don't get annual checkups already, and then you find yourself in a health situation, do you know where to go, what to do? I
Yeah,
know we talked about another subject, and that was on mental health. That most people don't know that CHI Emmanuel has one of the best mental health facilities in the area. But if you don't know these things, you don't know how to take advantage of it. And I'm sure the same thing goes with mortality and other things, or especially if you're pregnant. Where do you go, or at least find out about where you're at in your pregnancy? I don't know.
well, any clinic that's not a special place. When it
Okay,
comes to
okay,
having babies, every clinic, there's no like pregnancy clinics,
okay,
right? So you
yeah,
go to your primary care and you find out you're pregnant, and then you start getting prenatal care. So
hmm,
your primary care starts your prenatal care. There's no
okay,
special place. It's just going to the doctor, find out you're pregnant, and starting your prenatal care. So
nice,
that's it. It's it. So you got to go to the doctor first of all to find out. They got pregnancy tests, but even once you find out if you are pregnant at home, you need to go to the doctor to get prenatal care. So maybe that prenatal care piece is missing.
hmm,
They're
hmm,
finding out that they're pregnant because you don't have to go to a doctor for that anymore. And this should be verified though. I mean, because sometimes those tests are wrong. But once you find out you're pregnant, prenatal care is important. And so I think sometimes that is delayed because you're not going to a doctor. You know, you're pregnant and then you're winging it. Like, we don't have to have a book to you really do need prenatal care, but in
yeah.
terms of just having a baby, it's like you're supposed to take care of yourself, eat right, and it happens. It's not a big science,
Well,
but I
I'm going
think
to take
we
that back
can't.
to the first thing you said, which was anxiety and depression. Once you find out you're pregnant, depending on that situation,
Mm,
it might lead to some anxiety and depression. The person that you're having a baby with, the family situation.
yeah,
Are you ready to divulge that? And there's a lot more than, oh, hey, let's go to the doctor and then get prenatal care.
well,
Maybe it's
and
a little
that
bit
means
more.
you're talking about unplanned pregnancies, right?
Yeah,
So
yeah.
let's start there. Let's start with taking care of yourself, taking birth control if you're not ready for babies. Just making sure that you understand if you're going to be in that situation that it's going to be a whole thing. So prevention for babies is birth control. So
Hmm.
we were talking from a prevention standpoint. Get on some kind of birth control, or guess what? Sustain, no absentee. Just don't get, if you're not ready to have the baby, if you're not ready to be pregnant, if your body isn't in a situation, if your lifestyle isn't ready for that, let's just start with prevention. And then we
Hmm.
won't have to worry about your baby dying. We don't have to worry about your health care later on. Let's start with prevention. Let's start with abstinence. If you ain't ready, don't do it.
Right.
We gotta say it. I don't know. That's probably is going in deaf ears, but if you're not abstinent, get on birth control. There's
Yeah.
all kinds out there. There's all kinds out there, but be aware of those side effects as well. You know, and we cannot not. It would be remiss if we recognize the healthcare biases.
Mm.
I think part of the statistic out there for breast cancer, we've kind of pulled it back, and we will access to care. We talked about that and blah blah blah, but a lot of it is coming back to just healthcare biases. We're getting diagnosed, delayed diagnosis. We're being told, oh, you can't be pregnant, or you can't have cancer because you're too young if you have cancer. Maybe, oh, it's just something else, or maybe there's just a fear because you don't have a primary care somebody to talk about that. Maybe there's some shame involved, so you don't
Mhm.
go in and talk about that. All of those things um, can build on some healthcare biases. Doctors just don't, necessarily listen to Black women. Let's call it what it is, as much as they would probably need to. Um, there's still a big stigma about women, Black women being strong, and you guys can handle it, and you'll be
Mm.
fine because you guys have handled things over the years, and just this whole like Black women strong don't need care type of attitude from
Yep.
doctors, which sucks because I don't know where they got that shit from. Because yes, we are definitely show resilience. Yes, we're the mothers and the caregivers. Yes, we have shown how strong and awesome we are as Black women, but that does not mean we don't need good health care. The
I'm going to say
same
one
health
other
care.
thing that is a big elephant in the room is that the clinical world, the physician world especially, there's not enough Black physicians. You're not talking to somebody that understands your cultural
Absolutely.
situation, how to emotionally bond with you. And
Yep.
because there's just, and to get through the process of becoming a doctor is very, very rigorous.
Yeah.
It's very, very, I don't know if that's on purpose or what, but we just have a shortage of Black physicians in the country. So constantly you're now having to go almost, you would say, a stranger or someone else who now is going to, this is a very intimate situation. You've got to be able to share a lot of detail with, and maybe not, they'd understand, what that experience is all about. And so
Yeah.
now there's another, potential drop in be able to be seen and heard and administered to when it comes to your clinical care plan, and then you feel comfortable sharing. Because then, if there's only one or two, three Black doctors in the whole area, they're going to be inundated. So how are you going to get in to see them? So that all of those things, I think, come to bear.
Oh, definitely. That like face is important. Well, for one, it's like faces for all Black people because, of course, our whole fear of the medical professions, right? And so, as much as we can see like faces, the better our outcome will become. So, definitely, if you are smart enough to go into the medical field, check it out because we definitely need your face in the place. We need your face looking out for us. But that's a more of a long-term effect. I guess in the short term, just recognize that these things are out there. As Black women, just recognize that, we do delay our care because we're caregivers, and those health biases are out there. So when you go into the doctor, don't expect them to necessarily give you the care you want, but you can demand it. And you can get with a doctor that does give you the feedback that you want, or does, you feeling a good vibe from them and feeling like they care for you. You can change doctors as much as you want. I don't want people to think as soon as you see one doctor, if that doctor is, you ain't feeling that doctor, you got to stay with that doctor.
Yep.
You have total control of guiding your own health care. If that, you be like, I ain't feeling that doctor, who else you got? I want a white female. I want a Black female. You can't say Black doctors because there ain't a bunch of them out there, especially here in Nebraska. There might be somewhere else. I tried that the Black doctor route is very far and few in between, and as Black females, even less. So I did have a Black doctor sue CHI years ago, but she went into an administrative field. And so she ain't out there no more. My kids saw Dr. Kathy forever. She's a pediatrician still out there, but she's like the only one in Nebraska. So it's lovely to want to have that, but we really need people to get into that healthcare field to see that. That ain't out there. That is definitely not out there in Omaha, Nebraska. So I just say, get with a doctor that you understand, that understands you, that you're feeling that connection with, so that you feel safe enough to have him care for you, and then he'll actually care for you. That's all I could say. But definitely get a primary care and do your due diligence. Don't accept the first one if you ain't feeling them. You know what I'm saying? Just know that you have power in terms of who you choose to take care of you.
I agree with that.
Yeah.
And so this final takeaway, we want to make sure that our audience understands these takeaways. So they're like, hey, let's concentrate on the things that we can do right now. To your point, we can't just go get a whole lot of Black doctors. However, there's certain things that we can do because prevention is powerful.
Yes, definitely. And so for women, so women's health is really broad. Let's just not the top three. Let's just cover the top three things you can do, preventive measures that you can do to move on. So the top three are breast health, mental health, and what was it? Breast health, mental and heart health. Heart health is number one, right? That's the number one killer. Heart health, breast health, and mental health. So in heart health, definitely monitor your blood pressure. We're talking about stuff that affects your heart specifically. Reduce your sodium intake. Sodium is always bad for your heart. So is salt. Walk, man. We say walk almost every show, right? Yeah. That's all I do. People are like, how do you say? I walk. Literally, I don't go to the gym. I got a elliptical right there. And I got some free weights here down at the floor here. That's all I do. I hit that, and I walk. So there doesn't have to be a big expense in keeping healthy, but walking is always the minimum you can do. Carry your own weight and walking distance farther and farther. So start working small. If you can walk a mile, go 5 miles. Walking is just low stress on your body. You ain't running, you ain't hurting knees. Get some good shoes, you're good to go, right? Manage stress is another thing for your heart. That's easy to say, hard to do. right? Manage your
Yeah.
stress.
Right? Yeah, of course.
But as much as you can know your triggers, we talked about stress. We talk about stress almost every show. Know your triggers. Do self-care to balance that stress. We all going to have stress, but counteract that stress with good things, and balancing that stress with positive reinforcement to your body, and get some sleep.
Get
That's the
some
main thing for
sleep.
heart.
Wow, gotta get your
That's
rest.
another
I
main thing.
like that. You got rest is healthy,
Man,
right?
and prioritize your sleep. Not just get some sleep. Make sure that you're trying to go to sleep at the same time every night and you're waking up at the same time. Regulate your body and you're getting 6 to 8 hours. 6 to 8. A lot of people get like
Yeah.
4 or 5 hours sleep. I don't even know how people operate on 4 or 5 hours sleep. I personally, I can sleep 8 hours and no problem. I think I go to bed at 11 on the average and I get up on the average as 9. How many hours is that?
It's enough. But I want to ask you
It's
this, because
over
I
8,
know
right?
you're at a different stage of your life now, but remember
Yeah.
what you were 20 years ago when you're still
Yeah.
raising children, you're going to work every day. Were you getting that kind of sleep then? Were you resting at that point? Or were you develop that over time?
Well, for me, I've always went to bed at 10:30 all my life. And I've always gotten up as late as I can. So in college, like in school, you had to get up to be at school. But in college, I never took an 8 o'clock class.
Hmm.
Never. Because I wanted to get my sleep. It was too early. I can't operate good at 8 o'clock in the morning, y'all.
Hmm.
And when I got a job, guess what? I try to get a flexible job that I can come in by 9,
Right,
8
right.
to 9. They ain't
So
sweating you
you had
till
a
8
job that
o'clock.
fit
So
your lifestyle. That's the difference. Sometimes you
it's a
take on a
lifestyle.
job that really doesn't fit your lifestyle, and you're trying to fit yourself into it, creating the anxiety, creating some
Right.
depression, creating these issues that you can't get to your self-care, right? And take care of yourself,
Self-care.
right?
So the next one is mental health that kind of plays into self-care to me. You know, normalize therapy. So we gotta really look, Black people, we need mental health more than anybody. I
Hmm.
hope people are realizing that. Slowly we're kind of recognizing, but people, know Black people home, we won't do therapy. We won't tell people our business. No, who stays in the house, stays in the house, goes on the house, stays in the house. We have
Yeah,
all kind of shit to
yeah,
basically
yeah.
keep our anxiety and fear to chest, making us crazy. We need mental health. We need to talk about it. So we need to normalize therapy. Therapy ain't
Hmm.
nothing but a conversation.
Hmm.
It ain't nothing but a conversation with a professional, really, who's not going to judge you, who you can just tell all those dark secrets to, not a family member who's going to throw it up in your face later, not somebody who's going to hold it against you. It's like, oh, you went through that or whatever, whatever. Normalize therapy. Get with a mental health professional if you need it. Talk about it. Talk about it. Your rest again. For your mental health, you got to get sleep. Your brain has to turn off. Your brain has to rest and sleep. So mentally, prioritize your sleep, prioritize your rest. And rest can even just include meditation. Like some people like go to sleep during their meditation. If you are breathing and you are blocking out the world, it's okay to just that's resting. That's meditation. That's resting your body. Practice that. That's a form of rest that you can do.
I really like that.
Set healthy boundaries. What do you mean? What do you mean by that? Set healthy boundaries. These are mental healthy boundaries, right?
Yeah, yeah, or things that don't. If you're aware of your triggers around anxiety and depression,
Right.
specifically, like what causes you to get in that state of mind,
That
how
part.
can you sidestep things? Like step back, take a look at your own scenarios from a daily, weekly, monthly basis. Like, all right, these things are really causing me stress, and that could
Right.
be a job. It could be a job. It could be people,
Mm-hmm.
right? People, places, and things, right?
Mm-hmm.
So take some inventory around those people, places, and things that cause you anxiety, and then begin to lessen those interactions and get into something more. If you can get into something more positive that actually brings you joy, and
Yes.
that will begin to help you. Is talking about setting those healthy boundaries. All right, I know that's going to take me down a dark path. Let me look at something that's going to take me down a lighter direction if possible.
Right. So practice that mindfulness and pray. Look, I pray. If you're a praying person, prayer works. Prayer centers you. Prayers just keep you connected to your higher being. So when you just get overexhausted and you know you can't do anymore, when you say that prayer and just say, let God and let go, let God, that's what you need to do. It's this time where sometimes you just can't handle it all. For me,
Yeah.
like anxiety comes out of disorganization. I missed appointments because I was not organized this week. A lot going on. So I got to recognize when I got a lot going on, I have to really depend on my Google appointments. I got to make sure I put it in what I send you an invite. See, and so to put it on your calendar because
Yeah.
I didn't do that and I missed that appointment. So I know I have to do that, especially when I got a lot of going on. So that's me addressing, trying to figure out what the trigger is, which I know is a disorganization, and I have to get organized so I don't
Mm.
find myself in those situations which bring me stress
Yeah,
and anxiety.
exactly. Right. Stress anxiety, yeah, keep yourself more organized. Use the tools that are available, schedule yourself, and then understand. Also, a lot of people don't do this. Sometimes you have to miss not just some like just miss an appointment, but reschedule it because you're compacting too much time. A lot of times we don't realize how much time something actually is going to take. Even
Yeah.
though it's going to be an hour appointment, you really need 2 hours because you got to do preparation and do other things. So understanding those things is going to help you when it comes to getting into stressful situations. So
And
I,
don't
I
let me forget breast. So
no, no,
prevention, still
go
on
ahead.
breast. We hit mental health, we hit heart
Yep.
health,
Yes, we did.
breast health. Schedule a mammogram.
Mm-hmm.
Everybody should be scheduling a mammogram if you're 40 or above. Now that changes, but it's 40 right now. So schedule a mammogram if it's in your family or not. Schedule a mammogram if you're 40 years old or not. You can get breast cancer just by getting older. That's the only thing that you have
Wow.
to do is be able to get older. All of us are going to get older, so all of us can get breast cancer in terms of that, even men. So
Mm-hmm.
schedule your mammograms. Be proactive about it. Maintain a healthy weight, y'all. Maintaining a healthy weight is everything. It
Yeah.
really is. We're talking about obesity. Black folks are the most fat group besides Samoans, I think, out there. 60% of us are obese.
Mm.
60%, that's over half of us. So 60% of us are obese. So maintaining that healthy weight for all health issues is key, right? Maintaining your healthy weight. Know your family history. Now, when it comes to breast cancer and any kind of disparity, your hypertension, mental illness, know your family history. Because I'm going to tell you, I knew my family history. I had two uncles that have schizophrenia.
Mm.
I have alcoholism in my family.
Mm-hmm.
I have cancers of all type in my family. I know my family history, right? We got everything. We got crazy, fat, obese, cancer ridden. Everything is in our family. And pretty much if you dig back enough in your family history, we all got especially as black people,
Some
all of
things,
that is in
yeah.
our family
Yeah.
history.
Yeah.
But you really got to know like what's really there. Heart disease. Now, heart disease doesn't run in our family, which is one of the things we don't have, but heart disease could run tough in somebody else's family. Prostate cancer, that's really a direct connection generationally. Prostate cancer runs in your family. If your father got polyps and their father got polyps, and that's something for guys to understand. Know that family history because you are more susceptible to also have polyps or maybe have
Mm.
prostate cancer. So those are generational things to know your family history. Oh, and the big one, and this is not just for breast cancer. It says reduce your alcohol intake.
Yeah.
And I struggle with this because years ago that wasn't even a connection.
Yeah.
But over the years they have really linked alcohol to all cancers, really, but specifically breast cancer. And so, as somebody who knows better now and who's got information, more recent information, I have to do my due diligence to make sure alcohol is a direct link to breast cancer. And so, if you can reduce your alcohol intake to no drinking, it's best.
Do you know why? Because alcohol has sugar in it, and there's talk about what's the direct correlation to cancer is sugar. So it's
Yep.
not just alcohol. You got to look at your sweets, things that you're habitually taking that
And
has a
that's why it's a
lot of
directly linked to what?
processed sugar.
Diabetes?
Well, it's diabetes as well, but if cancer, sugar feeds cancer. It actually feeds on it.
Yeah.
So if you can reduce your sugar intake, it's going to reduce either cancer risk, or maybe you can get into a remediation of the cancer itself. But it
Hmm.
feeds on sugar. You got to be aware of that.
No. Good to know. Good to know. And alcohol has a lot of sugar in it. So,
Yes,
and
it
other
is.
carcinogens in it that you just don't want and need in terms of all your health. Limit your alcohol. Just kind of keep it in moderation, as they say, whatever that is for you. But just know it does definitely affect your health outcome.
Mm-hmm.
So let's talk about wealth a little bit. Of course, all disparities, all health issues, uh, affects your pocket.
Yeah. Yeah.
And so when it comes to women's health, we don't necessarily have that income as maybe men do. And so it's definitely going to affect how we move in terms of like, are we going to go to the doctor? Are we going to be preventative? Are we going to make sure that we take care of ourselves before we take care of everybody else? And so it's definitely your health outcome is going to be directly related to how much money you got and how you prioritize that money in terms of your health.
100%. And these, in today's world, because of the high cost of so many different things, people are starting to have to make decisions on, do I buy this drug today? Do I get my prescription today? Or do I eat today? Or do I have enough money for the bus or whatever it may be, the car, the gasoline?
Right.
And we have seen this. Social determinants of health are so important. And when I say social
Absolutely.
determinants of health, finance is always going to be a part of that. But these are realities. Number one, because of the Affordable Care Act, or obviously known as Obamacare, was very affordable for a lot of different people. And then now it tripled and more in certain cases, just to have the insurance itself. So now that's eating into your pocket. And then people that are on fixed incomes, they're starting to have to make decisions that they didn't have to make before.
Right.
So now they got to make that decision. These are, so like, how can I do preventive maintenance when I can't even afford basic, health care?
Right.
These are very important things. So getting back to what you said earlier, well, number one, being able to move and exercise is a low cost way to take care of yourself. I know Tisa's big on not being, addicted to having to take pills all the time.
Walking is free, right?
Walking's free, right?
Walking
Drinking water, just drinking water instead of alcohol and other things and things that have a lot of sugar content to them is going to
saves you money, right?
Yeah.
Pop is expensive. Alcohol is expensive. If you just kind of got rid of those things or one of those things, and like you said, put more water, alkaline water specifically, in your system, that'll save you money and it'll be better for you health-wise, right?
Yeah, they're starting to get some more holistic ways of doing things, so you're not having to just take expensive pharmaceuticals that can help you. It depends on your situation, and what you're doing. But there's many teas out there, certain things that are going to help you relax, get rid of the anxiety and depression. But finding ways to get the health care that you need, but not affecting your pocket, right?
Right.
Things that you
so that means prevention. That means prevention. Yeah. That means doing those things that doesn't cost money, right? Because it's going to cost you in the end if you don't, right? So walking regularly, getting your sleep, keeping yourself as healthy as you can so you don't have to go to the doctor or you don't have to be on medication is your prevention. So try to do all you can to prevent those things. And then you won't have to dip in your pocket to pay for those things.
It's amazing, like down in the U.S. Virgin Islands, and I go down to St. Croix a lot, they don't have a lot of money. Their per capita income is like $25,000. Wow, they don't have enough. And their healthcare system is not very robust at all. So what do the people do? They try to take care of themselves. They will go out and they have in their own backyard, they can grow what they call bush tea, B-U-S-H, bush tea. But that bush tea actually does a lot of remedies.
I've heard about that bush tea.
Yeah, and it's low cost. It works, but still you're not getting the diagnostics that you need going forward when it comes to how you protect yourself long-term for some of these other things. But understanding your intake and how to do things that are healthy is going to help you save money, right? So you don't because you don't want to get into crisis. That's the point. So I think women deserve financial protection as well, but you don't want to just start seeing professional when you're in crisis. That's the problem. That's going to cost a lot more money. Hopefully you do have insurance. You don't have insurance. No matter what, even we have catastrophic insurance. If you really look at your policies, say, well, what does my insurance cover? You need to know this because a lot of times the out of pocket is like thousands of dollars. So you're paying for this anyway until it finally kicks in after thousands of dollars because you're in crisis care at that point.
Yeah.
You don't want to get to that point. So be aware of where you stand financially if you do, get into a situation that you need clinical care.
Perfect. So we need to kind of wrap it up. Let's touch on relationships. Obviously, all these things are going to affect your relationships. You got to be mindful women, just be mindful that anxiety, exhaustion, loneliness, depression,
Mm.
all of those things affect us. And so being conscious of those things, and trying to proactively work against them is the best way. It's going to affect your relationship if you live with somebody, but the more you take care of yourself, the more your partner is going to have to take care of you, right? You don't want to have to be in a situation where you have to we're already caregivers, but have to have somebody take care of you, right? Because that may be your spouse, your kids, your parents, whatever. So as much as we can take care of ourselves, it'll affect our relationships in a better way, right? Because
Yeah.
I got a little bitter when I had to take care of my mom because my mom didn't take care of herself, and that's just keeping it 100. So as much as you can take care of yourself and don't be a burden on anybody else, that's the best way to go. It should be it shouldn't have to affect your relationship negatively because you didn't take care of yourself. So it all goes back to preventive care, taking care of yourself, knowing the signs, balancing out your lifestyle, and just being better at all that.
Being better, and remember this:
Doing better.
you cannot pour from an empty cup. So if you know that you're at
Gotta
the
take care,
end,
right?
you've got to fill your cup first before you can give out. So that creates a lot of anxiety and stress itself. And then
Absolutely.
asking for help, you gotta ask. We're in a community, and it's always those things. First, you gotta understand you are in need of help.
Right.
That's number one. A lot of
That's
people don't
number one.
realize they're in need of help.
Yeah.
And there is help available if you reach out. I think that's
If you reach out. And places that you can reach out to. So we're going to wrap it up with some resources. So we talked about mental health. CHI is there, and we're going to have Mr. Ashby on sometime soon to give you the ins and the details of CHI's mental health department. But that's what CHI has turned into. I didn't know that that's what they were. I just remember CHI kind of being trauma at some point, and but as a caseworker, I do remember like a lot of my clients being held at CHI for the evaluation period. So CHI is a good mental health place now. So if you need it, reach out, call them up, tell them I need to talk to somebody. You know what I'm saying? Methodist Hospital is always about women's health. You already hear about Methodist and women's health. So any health issues, they are a specialty in women's health and health care. Reach out to Methodist Women's Hospital for just specific things, but definitely for prenatal care, for women's health issues, mammograms, for pap smears, all those girl things. Methodist is a real good resource for women's health, and so is Nebraska Medicine. Nebraska Medicine has a great women's health department, comprehensive women's health. They are leading on all of the cancers, all the cancer research and all of that stuff. They are the #1 hospital for cancer. So in terms of any kind of cancer care, I would stop in at Nebraska Medicine. They got the funding, they got the resources, and they got the knowledge there. So make sure you stop in there for all your cancer needs. And let's not forget Methodist. Methodist also has a good mental health and women's specialty departments. Stop in at Methodist. Really, any of the healthcare providers in Omaha have a women's health component. But those specifically are good ones for mental health and for basic cancer health.
Excellent.
Any other resources you want to share? Susan G. Komen is still out there.
Yeah, there you go.
For resources, Project Pink is out there for cancer resources. Pink Lotus Project is out there for cancer resources.
I was going to say, make sure you go to the Pink Lotus Project Nebraska website. There's a lot of resources there in all those different areas of spiritual, mental, community health. Yeah, holistic health. So that's why you go to these. That's why you have this information out there. Go to their website. You'll see a lot of information there. I want to make sure that we go for a final call to action, which is around make sure we're scheduling these wellness visits. Because if you don't engage with them, they can't help you, right?
Please schedule some visits. Yes.
Schedule your visits. Check your blood pressure. Have some type of way to check your blood pressure every single day. Every time you start your car, you get an oil. The oil pressure is checked. Otherwise, the car is going to have a red light, and you're going to say, "Oh, okay, I got a problem." You got to do that for yourself. Check your blood pressure, right? Understand what that is, right? Prioritize your mental health. Encourage other women. I know I'm encouraged just by listening. I need to listen as men. We need to listen more. understand, what our mates or our mothers or our daughters are kind of expressing what's going on, and then know about these resources. Hey, maybe we should go down and make an appointment. Maybe that's what it is. You don't have to be the professional yourself, but you have to listen and be able to have some empathy and some sympathy around that. Remember to share these episodes that me and Tisa have been doing for the last year, but these types of things are for the community, because we want to be that grassroots voice. A lot of times we hear from these healthcare facilities. We need to hear from the people. We need to know what they need. So we're being that intermediary for that, to make sure that we're getting and having these tough conversations to say these things out loud so that we can hear them. So closing thoughts, Tisa, what you got for us?
Well, for one, like you said, check in all of our past episodes. We have over 20, and we always care. It's health, wealth, and relationships, with health being our main focus. And so we're going to hit all the health disparities and all the health issues for that month. So keep tuning in to that. I would say, like you said, be your own self advocate when it comes to your health, period, men and women. Take care of yourself. If they feeling right, move on, get somebody different. But just really be in tune to your body and put yourself first. As women, we put everybody else first. I would say as women, prioritize your health, put yourself first, and then you can take care of everybody else.
I love it. I love it. So make sure we strengthen our families, our communities, and our generations. I want to thank everybody again for tuning in to this episode on health, wealth, and relationships.
And remember to
we got to
eat
move
well
and move.
And move.
We got to move. We've been moving. We have been moving. I know I've been moving. All right. See everybody next week.
Time.
Imagine waking up with more energy, a peaceful mind, and relationships that grow stronger every day. That is the vision Tisa Harden and Grant McGaw want to help you achieve, and it all starts with simple, practical steps you can take this week. On Health, Wealth, and Relationships, every episode brings you real stories and trusted experts. Tisa and Grant focus on 3 tactical steps each week. Small, doable moves that protect your health, grow your savings, and bring you closer to the people you love. No complicated rules, just real progress. Try a clinic-to-kitchen swap to boost your energy. Start a money buffer habit that quietly builds your financial confidence. Or try a 1-minute exercise that helps you reconnect with your partner. These quick wins are not chores. They are steps toward a better life. People who try just one intentional step report more energy, less money stress, and evenings full of laughter again. Join Tisa and Grant. Start small, live bigger. Tune in every Thursday at 10 a.m. on Facebook, LinkedIn, and YouTube, and subscribe now.